Thank you for joining us. Today I have Dr. Glenda Romero and Dr. Patricia Kincaid, who are both with RadNet, here to talk to us about head and neck imaging. Thank you both for being here with us.
Thanks for having us.
So you both have specialties, so we're going to go ahead and we'll start with Dr. Romero. Tell me a little bit about what are some of the most common head and neck diseases that radiological imaging is used for?
Some of the most common diseases that we see in our practice include thyroid nodules, the just newly felt palpable neck lump or mass, see thyroid, head and neck cancer, carotid artery stenosis or vascular disease of the neck vessels, hearing loss, and sinusitis.
Hearing loss. Now that's the first time I've heard that. Tell me, how would they diagnose that? Would they have a head image?
They could either have a CT of the skull base, or the area that connects the face with the brain. Looking for the inner ear structures. Sometimes there can be tumors. Sometimes there can be infection of the inner ear structures that can cause hearing loss or loss of balance. So those are some of the common entities that we see.
Is it usually just one time that they would have to do the imaging for that, or is there multiple times?
It depends what we find initially. Let's say we find a tumor of the inner ear. So they may get radiation or surgery for that particular tumor, and then we'll do follow-ups to see if that tumor is gone or if it's staying the same size.
Dr. Kincaid, she talked a little bit about thyroid nodules. What are those?
The thyroid gland is a small endocrine organ that just sits in the front of the neck here, and it's very common to get nodules in the thyroid. In fact, most people by the age of 60 will have at least one thyroid nodule, and the vast majority of nodules are benign, which means not cancer, over 95% of them.
And what are they made up of?
Well, it's variable. Some are solid and some may be fluid-filled, and we call those cystic. If it's purely cystic, then it's totally benign and you don't ever have to worry about it.
And then also you would find maybe lumps on your neck. What kind of lumps are we looking for?
Most of the time, a neck lump is also going to turn out to be benign. But we do all sorts of imaging procedures for patients who have a newly palpable lump. A lot of the times they're mildly enlarged lymph nodes that occur after, for example, an upper respiratory tract infection. Any kind of inflammatory process in the head and neck can cause your lymph nodes to get a little bit enlarged. And they may stay enlarged for 2 or 3 weeks after your cold is gone. So it's always important to go to your doctor and have your doctor check it out to see if it's a lump to worry about. But like I said, a lot of them are nothing of concern.
So when I have noticed that what you were mentioning about an upper respiratory is that you do have enlarged glands. So what's the difference between having the enlarged gland and a lump? I mean, is a lump something smaller than, is it tiny, or would you just notice it right away?
Well, a lump is just anything that somebody feels. So if it's really small, like a pea size or an almond size, it's probably nothing to worry about. But if it's something larger, or if it's something that is getting larger over time, then those would be a little bit more worrisome.
All right. And you had mentioned a few different types of imaging that is done. Can you tell me some other things that are used for head and neck imaging?
For example, ultrasound. Ultrasound is used commonly to diagnose thyroid nodules. Sometimes there's also cysts in the thyroid gland. An enlarged thyroid gland, sometimes people will, a doctor will order a thyroid ultrasound to look, because they feel like the thyroid gland is enlarged. So we'll kind of take measurements of the thyroid gland and also see if there's any nodules that are concerning for malignancy. But luckily, the majority of nodules that we see are benign. Ultrasound is commonly used for carotid artery stenosis or vascular disease. So let's say someone has heart disease. Part of the workup in heart disease, let's say they have to have a CABG procedure or bypass procedure. A lot of times the surgeon will order a carotid ultrasound to make sure that their carotid arteries aren't significantly narrowed, because if they have narrowed vessels, that might have to be addressed before the heart surgery.
And then for the thyroid nodules, which one did you say was the best one to use?
Ultrasound is by far the best way to image the thyroid gland. It's very sensitive to determine not only the size of the nodules, but the characteristics of the nodule.
Okay.
And when we look at those ultrasound images, we look at the shape of the nodule, whether it's solid or cystic, what its margins look like, if there's any little bits of calcium in the nodule. And based on those ultrasound features, we're able to use a risk stratification system to determine which nodules can be safely followed and which nodules may need to be biopsied.
Okay. And then how long do the exams take?
An ultrasound takes about 15 to 30 minutes. A CT, for example, that's pretty quick, depending on whether or not the patient needs contrast. I'd say anywhere from 15 to 20 minutes.
Right.
An MRI is a little bit more involved, and that can take anywhere from 30 minutes to an hour, depending on what's ordered and whether or not the doctor orders contrast with that exam.
Okay, and let's talk about contrast, because I mean, no one likes it. Isn't there a pill?
No.
It's still the same. It's still the same. It's always been, right?
Yes, so it's important, I guess, for if the patient has a known allergy to contrast, to let their doctor know, and that way, if it's a severe allergy to contrast, they can be pre-medicated with steroids to get the contrast. But let's say they get CT contrast. When the patient's injected, it's a large amount, so it's important to be hydrated before the exam.
Okay.
Anyway, when they get the contrast, the patients will feel kind of a hot flesh feeling, and they may feel the sensation they have to go to the bathroom, and that's a normal sensation. But the most important thing for if you have to have a contrast exam is to be hydrated so that the technologist can start the IV pretty easily.
And
yeah.
she's referring to the iodine contrast that
Right.
we use for CT imaging.
Okay.
For MRIs, we use a different kind of contrast called gadolinium. And that is super easy to get, really very few effects, and really no medical concerns unless you have very severe renal failure, and then there may be some concerns.
Okay. All right. Great. Is there anything else that you'd like to tell us?
Just for general patients, if you have to have imaging, if you have previous exams from another institution, it's really important that you bring them so that we can compare to make sure that something's been stable over a period of time, or if it's growing. That's extremely important.
All right. Perfect. Well, thank you both so much. I appreciate the information.
Thank you.
Thank you for having us.
And for more information about what we've discussed here, please visit radnet.com. Thank you for joining us.